Good morning, everyone. I am Bhasker Dharavath, PhD student from Dr. Amit Dutt Lab, ACTREC. The title of my talk is MIR944 MMP10 AXL axis predicts lymph node metastasis in early stage tongue cancer. So, oral cancer, just oral cancer is the eighth most common cancer in the world. Although it is rare in the developed countries, it is the most common cancer, one of the most common cancers in the developing countries, with about 65% of all oral cancer cases in Asia. Also, if we see in India, it is the most common cancer in India among the males and second most common cancer among the females. And if we see about the prevalence in the oral cancer subsites, tongue cancer is the most prevalent cancer, especially among the younger age group of people. So if you see, unlike other cancers, oral cancers are so peculiar that even during the early stages, they metastasize to the lymph nodes. If we see the mode of treatment for the advanced stage of patients is standard that surgery and followed by chemoradiation. However, in case of early stage tongue cancer, which show about among these early stage tongue cancer, about 30% of the patients show lymph node metastasis during early stages as well, and 70% of them do not show any metastasis. So the patients who have metastasis in the regional lymph node, hidden metastasis in the lymph node, their survival decreases from 80% to drastically to 40%, and among the advanced stages, it is about 20%. So the standard mode of treatment for these patients in whom the lymph node metastasis is not detected by CT or MRI or PET CT is based on the landmark paper or clinical trial published by Dr. Dicruz sir, that it is tumor resection and removal of lymph nodes. Although the elective neck dissection leads to morbidity in these patients and also it is costly. And hence there is a need for identification of molecular markers to stratify these patients based on nodal metastasis status. So with this, we come up with a study from our lab which suggests MMP10 to be a potential candidate to predict lymph node metastasis in these early stage tongue cancer patients. However, there is a need for validation in large cohort of samples, as the samples in this study were limiting. There is a need for validation in large cohort of samples to establish MMP10 as a biomarker to predict lymph node metastasis. So the total samples that we used in this study are 219, which includes about 108 samples, 108 samples from phase 3 N0 clinical trial, and 94% of these samples are of tongue cancer origin and 75% are early stage. Also, 40% of them are node positive, with all of these are HPV negative status. So what we find from our validation in screening for MMP10 expression is that about 86% of these patients with lymph node metastasis have high expression of MMP10 or only a false negativity rate of 14%, which suggests that MMP10 could be a potential candidate to predict lymph node metastasis in the early stage tongue cancer patients. We further went ahead to characterize the role of MMP10 in metastasis using in vitro cell lines, in vitro studies. So when we overexpress the MMP10, if we see here, there is an increase in the migration as well as invasion of the cells. And when we knock down MMP10 in the two different tongue cancer cell lines, there is a decrease in the migration in both the cell lines as well as invasion in the cell lines, which suggests that MMP10 is involved in metastasis. Further, we went ahead to establish an orthotopic tongue mouse model in which we inject the cells in the tongue of the mice and they form the tumors in 25 days of time in the tongue of these. So we went ahead to inject these cells, 6 mice in each group, with control group which has high expression of MMP10, and when we knock down the MMP10, there is a significant decrease, that is about 100% decrease in the metastasis of these mice. That is 0 of the 6 mice formed tumors of mice showed metastasis in the knockdown group. However, in high expression, there were all the 6 mice had metastasis in the lymph nodes or in distant organs. So we further went ahead to understand how does MMP10 regulate metastasis. So we plan to study the mechanistics by finding the upstream and downstream effector molecules. To find the upstream molecules, we performed microRNA microarray of node positive and node negative patients and cell lines. So biochemically, we validate microRNA 944 as one of the candidates that regulates MMP10. This is by the luciferase assay. We have shown the direct interaction, as well as in the patient samples, we see that when there is high expression of microRNA, there is low expression of MMP10. Further, we went ahead in the cell lines to validate this, whether overexpression of this microRNA will inhibit MMP10, which we saw in the cells as well. And we see that both microRNA and MMP10 are falling in the same pathway, that when we overexpress microRNA 944, it inhibits the MMP10 promoted invasion and migration of these cells. In the patients also, we see that node positive patients have low expression of microRNA and node negative patients have high expression of microRNA. Further, we went to find the downstream molecules that are regulating MMP10. We performed a transcriptome sequencing of MMP10 overexpression in knockdown cells, and we found AXL signaling pathway to be activated upon overexpression of MMP10. So we also went ahead to knock down this and saw that there is inactivation of this AXL signaling pathway as well as the EMT markers, which we further went ahead to study in the cell lines and saw that when we knock down AXL, it inhibits the MMP10 promoted invasion as well as migration of these cells. So,
Dr. Bhasker, please conclude your talk.
Yes, sure. So we conclude from our study that MIR944 inhibits MMP10, which activates AXL and leads to metastasis of this cell. So to summarize, what we say is, from the patient primary tumor, when you screen for the MMP10 expression, we propose if it has the high expression of MMP10, perform neck dissection, and if it has low expression of MMP10, there is no need for neck dissection, which can save a significant proportion of patients from this neck dissection. And which we have proved in the in vitro cell based assays that if it has MMP10 overexpression, there is increase in tumorigenesis and metastasis, and where there is MMP10 knockdown, there is a decrease in the tumorigenesis and metastasis. And we have also elucidated the novel pathway of upstream and downstream regulators of MMP10, in which we have found one microRNA and AXL to be the effector molecules to regulate tumorigenesis and metastasis in this cells. So I thank my guide and Sudhir Nair sir, who is our clinical collaborator, for the samples, and also thank our deputy director ACTREC, and our lab members for their help, and our clinical collaborators, especially Dikru sir, Risha Vaish ma'am, Munita Bal ma'am, pathologist, and Poonam Gera ma'am, and Kavita Sonavne, and other members from TMH and animal facility. Thank you to ACTREC and CSR for fellowship, and I thank the organizers for giving me the opportunity to present my work here. Thank you.